a pleasure today to be here again with Dr. Wyger. Dr. Wyger is a very well-trained expert in treating obesity. And we want to talk for a moment or two about some, I'll call them barriers that come up in front of people when they want to make the changes that are necessary, really, and how you can help.
Right. Absolutely. I think part of it is managing patients' expectations with weight loss. A lot of times patients think that they can lose a tremendous amount of weight in a short amount of time and that their bodies will adapt to that and stay there. But that's really not the case. This needs to be a slow, progressive change. 1 to 2 pounds a week is kind of a healthy amount of weight loss to have your body with a new set point. And then we gradually lower that to your goals and try to maintain after that. So physical activity is only one of the 4 components that we utilize to help patients to achieve their healthy weight goals, and it's a very important one. However, nutritional intervention is another one that's very important, and that probably plays the biggest role in patients' ability to get to their weight to a healthy level. Also, behavioral modifications are important. So I'll tell patients things like, don't eat in front of a television screen or your phone because that's distracted eating. And your hunger and satiety cues get thrown off by that because your brain is no longer communicating with your stomach if you're doing those things.
Interesting.
And then the 4th component, which a lot of people will benefit from, is medical management. And that's really where we come into play to help patients to quiet the food noises that they've been hearing their whole lives and allow them to achieve the goals that they're looking for.
And why don't you drill down a little bit more on medical management? I mean, what is it?
Sure. Okay, so this is a very exciting time to be in obesity medicine practice because we now finally have access to some really good medications that can help patients to achieve long-term sustainable weight loss goals. And they've got great cardiovascular outcomes as well. They can help treat diabetes. They can help lower your blood pressure. And it's a really great time to be in this kind of medicine because we have a lot more options now. And insurance companies are starting to develop more coverage for that. And that's something that I encourage patients to advocate for themselves if they can.
Yeah.
You know, talk to your employer and see if they can get you to opt in to an anti-obesity rider on your insurance policy because that's something that could benefit you, and tell them it's an important benefit. So I really encourage patients to speak up on their own behalf if they can.
It's awesome. All of that was great. So the unusual word, but it's hope. I think sometimes people lose hope. They give up. They don't think they can really do it. But they need somebody like you quite often, I think, to encourage them and who has the clinical knowledge and background.
Absolutely. It's really important for patients to realize that this is a chronic condition, so it requires chronic treatment. And checking in with your doctor regularly to treat your obesity is important because we can then develop a plan and a strategy to help you if you hit a weight plateau, or if something isn't working for you in your plan, we can change things around, or if your nutritional needs change and that sort of thing.
That's awesome. I really am convinced that what you're doing is going to be really a great thing here, and you're going to be able to help a lot of people, and we really appreciate it.
Thank you.